Hello, my name is Simon Cook, and I'm the Programme Director of the Warneford Park programme here in Headington, Oxford. We're working on really exciting plans at the moment to develop a major brain health research and innovation campus, which includes a new mental health hospital. Soon we'll be submitting our planning application for this Warneford Park programme to Oxford City Council. But before then, we're taking the opportunity to talk to local people about these plans, hear your views and answer your questions as best we can. This video is part of a series that we've produced designed to provide more information on key topics. And today we're going to be talking about travel and transport. I'm really pleased to be joined by an expert in transport planning who's supporting the project with this work. A big welcome to Ronan. Hello.
Thanks, Simon. Hi all, I'm Ronan Wilson. I'm a principal consultant at iTransport. We're the transport consultants supporting the Warneford Park project. So I grew up in Witney and I spent a lot of time in Oxford growing up. So I understand and have experienced firsthand the transport issues and the constraints of Oxford and Oxfordshire.
That's brilliant. Well, it's fantastic to have that sort of extra local knowledge. It's a real bonus of you joining the project team. Can you explain a bit more about what a transport consultant does? Just a bit more about what that involves, who you work with.
Yeah, sure.
Yeah.
So as transport consultants, we're basically required to provide expert advice to the trust and the client group on the transport implications of the scheme. And we help the project team design and develop the world-leading mental health campus that we're seeking to provide. Our work today has basically been informed through continuing dialogue with the Trust, the University of Oxford, Oxford City Council, Oxford County Council, alongside other key stakeholders in Headington, including Oxford Brookes and the health centres associated with Oxford University Hospitals. I also attended the previous consultation event where I had the opportunity to discuss the proposals with local residents, site users and elected representatives in person.
So, Brendan, we've had a lot of questions about traffic and transport. It's a key area of interest and concern for people about how this is going to overall impact on the area. But before we get into some of those detailed points, could you just start by just reminding us exactly where Warneford is and how that fits with the current transport network here in this part of Oxford?
Yeah, of course. So Warneford Hospital is located here in Headington. It's just east of the Oxford city centre and it's located alongside the vast majority of other health centres in Oxford, along with various universities and schools. So behind only the city centre, it's the second largest employment zone in the city, with well over 20,000 workers coming to Headington, over which half work in the health sector and half commute from outside the city. So access into Headington is heavily reliant on Headington Road or London Road, which is congested during peak periods, but provides a key bus route between the city centre, Headington and the Ring Road. On the local roads around the site, there's good provision for cyclists. The site's served directly by 5 buses, although these route to limited locations. And then you've got the closure of Botley Road on the other side of the city, which has impacted congestion and cross-city bus services. But by the time this application will come forward, the works will be completed and the county will have introduced a series of traffic management and bus priority measures.
Okay, that's really helpful. So, so the key thing about this project that's really exciting is that we're pulling together health, education and research all on the same site to create this critical mass of expertise, innovation and excellence. And what that's going to mean is we're going to have more people working on the site, coming to the site, being cared for on the site. We're looking to have 8 wards rather than the current 4 wards for patients on site. We're having more researchers working on the site. We're looking to have startup companies, innovators working on the site. And of course, we're looking to turn the current hospital ultimately into a college, an Oxford College, with all the students and teaching staff and so on. So all of that added up, we're expecting in the region of about an additional 170% of people on the site. How do you go about assessing the impact of that on the local transport network?
I mean, yeah, that's a really good question, Simon. It's a question we're asked quite a lot, actually, as our role. So, yeah, as you say, the scheme is going to increase the number of people on site up to around 2,000 people, and these will all be different users. So, as you say, you'll have trust staff, you'll have university staff, you'll have college students and college staff. So, we've got to make sure we have a scheme that works for all of these people. So, clearly, it's a significant increase in the number of people will be traveling to and from site every day. So as part of our assessments, we need to understand how people currently get to the site and think about how they'll get to the site in the future.
Mm.
To do this, we've undertaken travel surveys of existing staff and visitors, traffic surveys of the site and the local road network, and we've also been able to compare these with existing data held by the City Council.
Okay.
So from this, we've been able to build a complete picture of how the site currently operates. For example, we know that 56% of staff travel from outside of Oxford City. We know that 67% of staff currently drive to the site. We also know when trust staff are arriving and departing for shift work. So basically, from these surveys, we're able to establish a baseline and can begin to assess different scenarios, including impacts on the local road network and impacts on cycling and bus networks and public, and the kind of things that we need to provide to allow for all these new people to come to the site.
Yeah. Okay. No, it sounds pretty complicated and comprehensive.
Indeed, it is.
So, and you mentioned there about different ways we were coming into the site. Now, the Warneford partners, and when I say Warneford partners, I mean the NHS Trust, Oxford Health, the University of Oxford, and its partner, that's all coming in on this project. They're all absolutely committed to maximising the proportion of people who travel to the site coming by bike, by bicycle, on foot, using public transport. That's absolutely the commitment. We're trying to move in that direction. So in terms of the plans that you've been helping to build, how are we doing with that ambition?
Yeah, well, it's really helpful to have like the project team who really want to provide a really forward-thinking site for the future, and it really aligns with the goals that we're looking to do. So, as I've just said, 60%, 67% of people currently drive to the site, and we also know that only 17% choose to walk and cycle, 14% choose to travel by bus. So, how do we go about changing that? So, the city and county councils have set very ambitious targets to reduce the number of vehicles in Oxford to encourage more sustainable modes. So, such as seeking to remove 1 in every 4 vehicles by 2030, and also halving the number of drivers in Oxford by 2040. So that our scheme tries to align with that. So alongside the trust and the university and the partner team, we've been working really hard to create a transport vision that is able to meet these objectives set by the county and city councils. But also it needs to be a realistic opportunity for future staff, visitors and students to get to the site. So this means we're having to significantly increase the number of people getting to the site by walking, by cycling and by public transport, whilst also appreciating that many people will continue to commute from outside the city. And in the case of many trust staff, at unsociable hours due to the shift patterns that they work. So we're confident that we can encourage around 30% of people to walk and cycle to the site and 38% of people to use public transport. But without this vision, we can only imagine what the traffic would be like in Headington if people continue the travel habits that are going on at the moment.
That's really helpful, because there were a number of questions about what we're doing to improve cycle provision, for instance. I think we're going to come to that later. We could hear about some of those things, but we're clearly trying to move in that direction. So I mean that sounds really good in terms of that ambition level. We're trying to push it in terms of that shift. But let's get down to the bottom line. If we do all that, what does that mean then for the car parking on site?
Yeah, I mean, it's a good question. So we've got a huge increase of people walking, cycling to the site, and Also, remember that public transport users will have to walk once they get off the bus. So our priority is to have a landscape-led master plan, putting pedestrians and cyclists first, and removing the surface car parking from the grounds and outside the building entries. Therefore, whilst the proposal is to increase parking on site by around 180 spaces, these will predominantly be at new basement level, so freeing up the ground and the surface for walking and cycling routes, and to dot around cycle parking and other active travel infrastructure. So this still more than halves the proportion of those travelling to site by car from the existing. So we've currently got 6 car parking spaces for every 10 people, and we'll be reducing it to less than 3 car parking spaces for every 10 people, which I think is a really ambitious target.
So, I mean, that sounds, I guess listening to that, it sounds good that we're trying to put most of the car parking, all of the car parking underground, actually, isn't it, in the basement?
Yeah.
We're going to have so we haven't got much car parking at surface level, at ground level. But you did say there that nevertheless we're looking to increase the parking overall by about 180 spaces.
Yeah.
And quite naturally, people are going to be concerned of saying, well, what does that mean then for the local neighbourhood? That is more cars. I mean, I know we're doing this shift with as much as we can to public transport, to cycling and walking. But nevertheless, despite all that, we are looking for more car parking spaces. What's the impact going to be on the local area, the local traffic, traffic, the nearby roads? How have you gone about assessing that? What does that look like, that impact?
Yeah, so it's a key part of our work that we do. In all of our work that we do, we have to assess the impact that it would have on the local road network, the local cycle networks and bus networks, for example. So, as I explained earlier, using the baseline surveys, we're able to assess the impact of the scheme on the local road network. So, the provision of around 180 more car parking spaces, it would actually only add an extra vehicle on 2 arms of the nearest junction every time the light turns red during the busiest hours of the day, so 8 a.m. to 9 a.m. and 5 p.m. to 6 p.m. This is because a large proportion of the staff actually work shift patterns and travel outside the busy periods of the day. So the impact is actually going to be a lot less than people would expect. Put simply, like around 2 more cars per minute will not be perceptible to those living nearby, but what will be obvious will be the great increase in number of people walking to the site, the number of cyclists that we'll see entering the site, and the number of buses that will be serving the site, and the improvements to the local bus stops, the improvements to the walking facilities and cycling facilities at nearby junctions and on the nearby roads.
Yeah. Okay. No, and just to help give us a sense of the kind of scale on that, you're saying 2 extra cars per minute at those peak hours, which presumably is Monday to Friday as well.
Yeah,
the weekends correct. Wouldn't be peak. What kind of proportion of increase on the traffic already on the road is that? Is that like a 20%, 10%? Well, what's the kind of proportion increase we're looking at?
It's around 10%, between 10 to 15% increase. But if you think of it in terms of what you see on the ground, it will literally be a car pulling up, and you will be able to count 30 seconds till another car will pull up. That's the increase that the development provides. So okay. Visually, will be imperceptible.
Yeah. Okay. No, thank you. So I think in summary, then, what you're describing is a very significant shift in the proportion of people who are coming to the site by public transport, cycling, walking, which will a much reduced proportion coming by car, although that will mean an overall increase in parking by 180 spaces we've just talked about. I suppose the big question for me is, what are we doing to help make that happen? Because some of the questions we've had are around how we're trying to encourage cycling, how we're trying to make that better, how we're improving public transport, etc. So, because there's got to be something around how we're improving things to enable that to work for people. So, can you tell us a bit about how we're trying to make that shift and what the plan is to make that possible.
Yeah, absolutely. So just to give you an idea of scale, so there will be more people walking and cycling and than driving. There'll be more people taking a bus than driving. So we've really got to make sure there is a system in place for people to get those buses and people to walk and people to cycle to site. So we'll be working really hard alongside the trust, the university, the city and county councils to deliver a scheme that really heavily promotes and invests in walking, cycling, and public transport. So we've been working hard for a while to come up with some strategies, and it's a continuing dialogue with the local councils. But some of the key components of our strategy will include major on-site improvements to prioritise walking and cycling over vehicles. So we're really going to try and, at the surface level, encourage people to walk and cycle. There'll be significant walking and cycling improvements at the Roosevelt Drive, Warneford Lane, Old Road, Gypsy Lane junction to really encourage cycling, to prioritise walking and cycling at those junctions, and also along those roads, so Warneford Lane, Gypsy Lane, Old Road, Roosevelt Drive, improved cycle facilities, so cycle lanes, and to really discourage the idea of people to drive to the site. So we will also provide high quality cycle parking at the site to massively improve on what's currently there, including shower and changing facilities. In terms of buses, which is a key one, as I've said, we've got public transport is huge at the moment. We've really got to push that. So we're committing to a contribution of around £1.5 million to enhance bus services to meet the expected future demand. Commitment to upgrade existing bus stops near the site. We're looking alongside the trust to the potential to provide an express shop bus service during busy periods from the park and ride sites to not only Warneford but also the other trust sites across Headington. Providing the majority of parking in the basement, as we said earlier, and we're going to implement parking permits. We'll be working closely with the wider trusts to ensure a coordinated area-wide strategy. And finally, the main thing that will bring it all together is like a robust travel plan, which outlines the targets and the measures that we monitored. They'll be monitored on a biennial basis, so we'll know where we're meeting our targets and what we need to do to improve. So ultimately, we've got a huge challenge there to encourage a lot of the existing staff and then the future staff to travel to the site by sustainable modes. But we believe our transport vision sets out an ambitious but realistic future for the Warneford Park site.
Yeah, that's fantastic. Thank you, Ren, for describing all that. And I have to say, as a cyclist myself and having done a lot of cycling to Warneford Park, I mean, those things I can straight away see the benefit of that.
Likewise, yeah.
Showers, changing facilities when you get there, as well as being able to get there in the first place by that. So that's really helpful. Thank you. I think that concludes our time now in terms of talking about traffic and transport. Thank you for those who've been watching. Really appreciate your interest in the Warneford Park project. We think it's really exciting, but we hope we've been able to explain our plans here in more detail. And I hope it's been useful for you. Please do look at our website for more information and to stay informed as well for further updates. And finally, Ronan, thank you so much for your time. Appreciate it.
Thank you very much for having me. It's been a pleasure.
Okay, thank you.